Hello and welcome to today's webinar, Advanced Healing and Pain Management, HEIT, High Energy Inductive Therapy with emFieldPro. This webinar is presented by Zimmer MedizinSystems. I'm Regina West, hello. I'll be moderating the webinar today. During the presentation, you may submit questions by typing them in the Questions tab on your webinar control panel. After the presentation, we'll cover those questions live. If there isn't enough time to get to all of the questions, answers to your questions will be emailed to you. And now I'd like to introduce the speaker for today's webinar. We have Dr. Rod Tomczak standing by. Let's bring him on camera now. Dr. Tomczak, would you please join us? Here we go. Hello. How are you, Dr. Tomczak?
Hi, how are you?
I'm very good, thank you. I'm excited to hear your presentation. Before we get to your presentation, I'd like to present a little of background information on you. This is Dr. Rod Tomczak, MD, DPM, EED, a triple doctorate holder, EDD, a triple doctorate holder, and he's a board certified an ankle surgeon, foot and ankle surgeon with over 4 decades of experience. He's also a member of Mensa and the International Society for Philosophical Inquiry. He began his career in Monroe, Michigan, establishing a successful private practice, and later he held roles as Chair of Surgical Care, University Curriculum Committee Chair, and Surgical Residency Director at Des Moines University. During his time there, he earned a second doctorate in curriculum and adult education from Drake University. He then moved to the Ohio State University, where he served as the chair of the problem-based learning curriculum and co-chair of the medical school curriculum committee. He's been the founding dean of medical universities in Belize, Curacao, and Saudi Arabia. Dr. Tomczak recently demonstrated the effectiveness of Zimmer MedizinSystems' emFieldPro HEIT, High Energy Inductive Therapy device, and enPuls Advanced Radial Shockwave Therapy in managing arthrogenic muscular inhibition with Patellar Baja, successfully avoiding the need for an above-knee amputation. He also published an article detailing this breakthrough treatment. So if you're just joining us, I've just introduced Dr. Rod Tomczak to speak on advanced healing and pain management HEIT, High Energy Inductive Therapy with emFieldPro. And Dr. Tomczak, if you are ready, I will hand control over to you, and we should be able to see your screen and your presentation in just a moment.
Okay.
All right, there we go. I'll check out and I'll check back with you when you're finished.
Thank you.
Take it away.
This all came about when I ran into a patient who was unsuccessfully treated in the conventional medical and surgical manner after a right total knee implant that became infected, and subsequently endured 5 surgeries. The patient was very despondent and despair when I finally saw him. But what's interesting is the way that this came about. Incidentally, I'd like to welcome all of you people out west to the Big Ten. I'm sure you'll enjoy the competition, as we will. You're in the field of big budgets now. This gentleman seriously contemplated an above-knee amputation because the right lower extremity had become totally useless. You may be familiar with people who have a traction injury to the brachial plexus, and their arm becomes paralyzed, and it gets in the way more than it's useful. So a lot of these people ask to have their arm amputated. They can use their left arm, and they can accommodate pretty well. But when you lose that leg, a couple things happen. number one, your life expectancy goes down considerably. The life expectancy for an above knee amputation with prosthetic is less than 5 years. The reason for that is because of the increased use, the increased need for energy to get around. When this patient came to me, I had no idea this was going to happen, and I received an email out of the blue from Zimmer MedizinSystems about the emField High Energy Inductive Therapy, and I had never been in contact with this Zimmer before. I kind of put it away because I didn't really realize what this email said. And then I got another email from Dan Uris in Boca Raton, Florida. And it talked about a patient that he had, and it looked similar to what I was dealing with. And I called him up, and he called me back after office hours, and we had a very pleasant chat. And he said that the emField worked wonders on this patient, and that it didn't take much time before the patient began to see results, and their progress was consistent. Then there was another healthcare provider in Great Britain. So what we had to deal with was a patient who was paralyzed and a patient whose gluteal muscles were paralyzed, and the emField had dramatic results. So Dan told me about Gerald, and I called Gerald, and Gerald was, again, very accommodating, and he told me about the device and how to get a hold of it and how to get this patient treated. So I began to do that. Now, during the course of this patient's treatment, before I became involved, the patient was told that this was a normal course after an infected total knee. What compounded the problem was the fact that there was a period during COVID when the patient could not have physical therapy. The patient could not attend the sessions because that was not considered that important here. And the patient was given instructions on things to do at home, but of course, was not able to use any of the highbrow or more advanced therapy modalities. So I was very surprised, and I was very hopeful when all these things seemed to come together. And when I told the patient, they said, "Let's go for it," because this patient, and I'll say this again later, after COVID, had been to 258 physical therapy sessions without the least bit of improvement. Patient was unable to walk on the right leg. When the right leg bore any weight, it just literally collapsed. There was no vastus medialis. Nobody told the patient to try and strengthen the vastus medialis. And I kind of found this out by myself. Let me add that when I taught in Des Moines University is an osteopathic medical school, and I took the manipulation course there. Not that I practiced any manipulation, because that's out of my lane, but just to become familiar with the thoughts, beliefs, the therapy, and the expected results of manipulative therapy. I thought it was important for me to do this, but not being an osteopath or a chiropractor, I was totally unaware of what manipulative therapy actually did. So 258 physical therapy appointments, and I checked this with Medicare. The patient did go. I mean, this guy started this whole journey when he was like 72 or 73 years old, and he's a lot older now, 4 years older. And so it's been a real trial. And you could see why the patient would become despondent, despair, and just get rid of this leg because it doesn't do me any good at all. So these are the 6 things we're going to try and talk about this evening. I pretty much beat the introduction to death, but we'll go over it here again. So when he was 72, he had the first total knee arthroplasty on the right side. He had also, prior to the arthroplasty, had Synvisc injections in both knees. He'd also had a right shoulder replacement. Both hips were replaced, and the left knee was replaced successfully. The patient made some sort of a living playing contact sports and played them well after retirement in recreational leagues. It was ice hockey. The patient developed the 2 parallel diagnoses. One is arthrogenic muscular inhibition, and the second is Patellar Baja or Baja patella, where after the surgeries, the patella moves down in the femoral groove more toward the tibial plafond than is normal. The theory behind this is that when the leg tries to extend, it comes to a hard stop because the patella is abutting the femur, the head of the femoral groove, and not fitting into that groove and moving proximally. So there's a hard stop there. And as a result, the patient cannot straighten the leg. The patient, I think, lacked 15 to 18 degrees of extension when I first saw him. So this is the X-ray of that patient. You can see the normal left leg with a normal patella. This is the right leg, and this is much later. This is in 2023. You can see that the patella has become osteoporotic. It is shrunk in size, and you can see that it's much lower than a normal patella position. So, like I said, I got the email from Zimmer and got in contact with Dan and got in contact with a British therapist who all said that this was a great device. So I contacted Dan, and he put me in touch with Gerald and Yorick Whiting, who's a doctor of physical therapy in California. And all these people were extremely gracious. All of them wanted to see me have success with this patient. And the cooperation was incredible. I was very pleased. So the mechanism of action of the emField is a coil that carries a low frequency alternating current, and it generates an electromagnetic field. Now, a good example of this is when you went to open a savings account or a checking account at the bank, and they gave you that all-weather storm radio where you crank the thing up and it lasts for about 30 seconds. What you're doing is you're converting mechanical energy to electromagnetic energy because there is a magnet inside this radio, and a coil that this magnet flows through. This is exactly the same theory as the Hoover Dam, Niagara Falls power plant, Robert Moses power plant that use waterfall coming down the dam as the source of mechanical energy, and inside are the magnets that then convert this mechanical energy into electromagnetic energy. You can't ask me too deep of questions on this because I was not a physics major. I majored in philosophy. The mechanism of action, like we say, it induces a current to flow through the tissues because now we're directing it with the applicator onto an area of the body that we want to affect. So the current evokes a nerve depolarization, and that is variable, determining the frequency and the intensity or the power that we have selected. Okay. And what we want to do is we want to get the maximum intensity, and we want to get the maximum frequency that's comfortable with the patient. We will not injure the patient. That's not possible if we follow the directions. There's certain contraindications that we'll touch on as we move along, and those are the things we have to be careful of, and we have to get a good history to make sure that we're not influencing these conditions. Okay, so excuse me. Commonly used frequencies in rehab are 1 hertz to 300 hertz, and that's the conventional nerve stimulator, or a TENS unit. I don't know if any of you have ever used the TENS unit yourself, but a TENS unit can work to block pain. It doesn't help with rehabilitation, but it does block the pain. 300 hertz is still a very low frequency, and going up to 100 kilohertz. 100 kilohertz, it begins a radio wave frequencies, and that goes up to 100 megahertz. So this is the scale of the electromagnetic frequencies. We're going to deal down here. That's why I say we're not going to hurt anybody, because the wavelengths are very long, okay, and the energy is non-ionizing. So we're not going to burn anything. We're not going to cause damage to the tissue. We can either polarize or depolarize depending on the selections that we use. All right, you can see here we start radio waves, and all the way up here is the X-rays. That's where damage can be done. Ultraviolet light rays also. This is the visible range. This is the light that we can see. But remember, we're dealing up in here for low frequency ranges. Now, the high energy inductive therapy, that is the M field, as compared to the conditional or traditional PMF, we are using 2 to 3 Tesla. This is the strength of the magnet, where in traditional pulsed electromagnetic frequencies, they're using less than 70 microtesla. 2 to 3 Tesla is about the same as a good MRI. Now, an MRI does have X-ray capabilities. That's what the MRI is. CAT scans do not use any radiation. So MRIs can use radiation, and theoretically, you're in the tube long enough that you could, under certain circumstances, cause some kind of a change to the cells. But with traditional, you're not gonna cause any difference. You can see that there's a sensory component. The high energy intensive therapy is felt by the patient. And Dan told me, and so did Dr. Whiting and Gerald, to turn up the device until the patient started to feel uncomfortable, and then back it down. What I noticed with our patient is that this changes the strength and the threshold of sensory knowledge to the patient. It changes during the course of treatment, and as we get better, as the patient gets better, we don't have to use as much power or a higher frequency to get the same effect that we did earlier. Okay, now in motor and strengthening, what I noticed on our gentleman is that the muscle, and I wasn't even thinking about this, and it was something that we'll talk about later, but I only treated the right leg because that's the leg that was affected with the surgery, okay? And remember, he was non-ambulatory. So the muscle grew, he was not able to really exercise it that much. And I told you that he, on extension, he was minus 15 degrees of total extension and was at a hard endpoint. So you can't even jam his lower leg up onto the femur. It stops. It's not painful because there's an implant in there, but it stops, and you can't really get that full extension. Even now, when he walks, he wears a brace which lacks about 7 or 8 degrees of extension, and I'll tell you why when we move on, why that is. So it does strengthen the muscle, but in the beginning, I only used it on the vastus the oblique head of the vastus medialis, because that's what the literature told me on the arthrogenic muscular inhibition papers. And so I used it there initially, and then I noticed that was becoming stronger, but I was neglecting the other muscles in the leg. So I started to use it on all the quads, the hamstrings, and the calf, and they all hypertrophied. Because during the course of his treatment over those 4 years, he had significant atrophy. I mean, his calf looked like it was like this pen. It was pitiful. He had no strength. The penetration is deeper with the HEIT. There is no heating on either of these devices, and both of them do facilitate metabolism, but the high energy inductive therapy, the emField, facilitates metabolism a lot better. So here we have our magnetic field in medicine, and that's our MRI. And most stationary magnetic fields are 1 to 3 Tesla, measured in that strength. It produces no heat, no depolarization there, because it's far enough away from the patient that it's not going to cause any muscle contractions. Remember, for a muscle to contract, it's got to depolarize, it's got to refill, polarize, and depolarize again. And what that looks like, so the emField restores the normal resting potential of an inflamed cell membrane. So what causes the pain and the damage is the toxins, dioxides, and the swelling, the edema, the water. And the emField opens the cell membrane so that the toxins are released, and we can replace that then with nutrients, oxygen, and minerals needed to get normal depolarization, normal strength, and normal functioning of the muscles. So we've improved the cellular electrochemistry. So we're working now on the molecular level, not plainly on the cellular level, which is a big step to be able to say, yeah, this works molecularly, not just cellularly. So the emField stimulates cellular signaling pathways. We just showed that. And by doing that, we release endorphins, and that reduces the pain. The endorphins are released when the cell membrane is opened up and toxins are released, and the nutrients and electrolytes are pushed into the cell. So we also stimulate growth factors. And the growth factors that are now going to be present are fibroblastic growth factors, vascular endothelial growth factors, and that's important because you're going to hear people say, well, you can't use that if it's a fracture. Well, in primary bone healing, what we want to do is we want to increase vascular endothelial growth factors so that blood vessels can anastomose themselves through the two ends of the fracture. And then the Swiss developed that theory since the 70s, and now we know that we can also stimulate the growth factors for the vascular growth factors through early mobilization and early range of motion. Bone morphogenic proteins, same thing. The bone has got to heal, and this causes new bone to form. And insulin growth factors, we want the sugar and the glucose to go into the cells and not to circulate through the system in the bloodstream. Now, what are our indications? When can we use this? Technically, it's easier to say when you shouldn't use it, but let's go through all the possible things that we can use this with. We can use this to relax muscle spasms. The patient comes in and, muscle spasms are really painful. We used to think that muscle spasms were a good thing. This is back when I went to school, and if you're not my age, you don't remember this. But it was important when for example, if you sprained your ankle, well, the reason you couldn't move it was because of the swelling and the physiologic splinting that occurred. And so this was good because this allowed things to heal. That's what we were taught. But we found out through the years that that's exactly the opposite. We want early mobilization, we want early range of motion, and if possible, early weight bearing. If we relieve the spasms, the patient is able to accomplish this on their own. It retards disuse atrophy. I talked about that. The muscle will grow if you use the emField. You apply the applicator, and it doesn't grow as fast as a cheetah pet, but it grows. We increase local circulation, and that local circulation contains all the growth factors. So if you want those new growth factors present, the emField is a good tool to use. We can re-educate the muscles. Dan and Gerald and Dr. Whiting explained to me, Yorick was very good about this. Yorick Whiting, he said that in the cycle of the emField, there's different frequencies that it fires at, and there is a very rapid frequency, and when that occurs, it's paramount that you get the patient to contract that specific muscle as strong as possible. And I think it's for like 10 seconds, but that helps to re-educate the muscle and to get it to fire properly during whatever cycle it's going to be used in. We can use it post-surgically, especially in the cath, to prevent phlebitis. We certainly don't want to cause an embolus to occur, although most venous embolus that move to the lung have to occur in a larger vein, like the greater saphenous in the thigh or the femoral. And we can use the emField to keep the blood flowing and to keep that from occurring. And I'm going to tell you later, if it's already there, if phlebitis is already present, that would be a contraindication. Okay, we also can use this to maintain and increase our range of motion. So when we get to that certain cycle in the emField, there's 3 different cycles for each phase, and we go through 40 or 50 at least, during the course of a 20-minute treatment. That we want the patient to contract that muscle so that they are stimulating that range of motion and increasing it each time that they do it. And that's important because remember, like I said, we used to think we wanted everything stabilized, immobilized, non-weight bearing. I can remember patients getting bunions fixed that were in the hospital for 2 weeks, non-weight bearing. Now they're going home the same day and walking on it. There are certain soft tissue pathologies that we can use this for. So this is a list of probably the 6 most common: myositis, tendonitis, bursitis, synovitis, sprains, and strains. So every soft tissue injury, there is an indication for the emField, and its use is strongly suggested. And I've seen it now used on other patients, and it really does help all these conditions. It helps bursitis. It helps a sprain or a strain. Simple myositis, an overuse syndrome, it helps greatly. An overuse syndrome is probably a myositis if it occurs in the muscle, and it helps to relieve the pain, relieve the spasm. So here are the contraindications. We don't want to use this over an implanted electronic device because it can change the firing of that electronic device. For example, if you have a demand pacemaker, that could change when it's going to fire. If you have a defibrillating pacemaker, it can cause the pacemaker to discharge. So you see a pacemaker implanted in the upper left chest. Stay away from that. Stay away from the whole cardiac area. So an example, you remember Damar Hamlin, who was the defensive back for the Buffalo Bills. Well, in the ECG cycle, there is a certain place where if a blow is delivered to the sternum, it causes the cardiac muscle to depolarize so that it can't be repolarized. Okay, it's usually people that suffer from Wolff-Parkinson-White syndrome, but if you don't have an EKG, you won't be able to pick that up. So stay away from the sternal area. You don't want to place the plate over active neoplasms or infections, because with the increased blood flow, this can cause the infection to spread, or it can cause the cancer tissues to get into the bloodstream or into the lymphatic system and spread. And you certainly don't want that. Now, if a patient has a diagnosed phlebitis, we want to stay away from that leg. There are certain cautions that, and if you just think about these for a second, you go, yeah, that's a good reason not to use it there. So you don't want to use it over endocrine glands, because let's just use the thyroid. You can cause more thyroid hormone to be discharged into the blood. So you don't want to use it there. We're not talking about exocrine glands, merely endocrine glands. We want to keep it away from those. If there's a bleeding disorder, it could theoretically cause more bleeding. Now, if a patient is on anticoagulants, an injury to a blood vessel is not any different if a patient is taking an anticoagulant, Eliquis, than if a patient isn't taking it. The difference is when the patient is taking it and you injure the blood vessel, it's more difficult for that blood vessel to coagulate and stop bleeding. That's important. So you're not going to cause any more damage or any blood to be released, any hemorrhage to occur, than if the patient wasn't taking Eliquis. But it would be more difficult, and there'd be more bruising, which that can be very frightening to the patient if they see that. And in a hemorrhage, gravity will cause that hemorrhage to spread down, and it will look like the patient it has a lot worse injury than they do. And this will spread subcutaneously, and that's a phenomenon we call tattooing. We don't want to put this over the uterus during menses, bleeding. We don't want to increase that. Patients don't like to see more blood. If there's a seizure disorder, there's two types of mechanisms on these seizures. One is a spreading component, and the other is a threshold. There's very few indications outside of neurologic or neurosurgical problems that there would be an indication for the emField. If a patient has a history of a seizure disorder, I would just stay clear. because I don't know if it's going to be, if we're going to cause a lowering of the threshold and cause the seizure to occur, or the spreading component will be increased so that what could be a focal seizure now grows into a grand mal seizure. Well, we just don't need that to occur. So these are a couple of things that I found. These are unpublished, and if they ever are published, they'll be in the obscure journal of medicine, because there's no scientific proof for this, but I just noticed it. So there are multiple muscle contractions and relaxations. Like I said, I use this on the quadriceps, I use this on the hamstrings, I use this on the adductors, I use this on the calves. Well, if you went to the gym and you worked out all those muscles, you would be sore afterwards. And the same thing occurs when you use the emField on all these muscle groups. And but it's nothing to be concerned about. They're just sore and weak, like you would be if you went to the gym and had a difficult workout. Okay. I also noticed that if you treat the gluteal region, that there is an increase in peristalsis and borborygmi, my favorite word, which is a high-powered word for bowel sounds. But they're the bowel sounds that you can hear while you're just sitting there. No stethoscope on the abdomen. And you've heard those. But the patient feels like they need a bowel movement, and they do. So if this occurs, you just have to stop the treatment. Patient uses the bathroom, comes back and resumes the treatment. And if you're going to use the emField on the gluteal region, you might want to tell the patient beforehand, this may happen. Don't be embarrassed. We're all adults here. Lower extremity treatments can make walking feel difficult immediately after the treatment. That's, like I said, that same thing with multiple areas treated, you feel weak. If you just on the lower extremity, you do feel weak walking. So when they stand up first few steps, they may need some assistance. Now, I was not familiar with motor points anymore. Freshman anatomy was way before you guys were born. There is a book, the first edition was in 1964, I think. I got the fourth edition in 1973, and it's merely called The Extremities. It's by two guys, Quiring and Warfel, who were at Case Western, which was nice. And I was in Cleveland, and it shows this is a book, an anatomy book that is completely made up of drawings. It looks like a coloring book that hasn't been colored in, but it shows the motor point for every muscle, every skeletal muscle in the human body. And if you're going to take the time to use the emField, you might as well know how to get the optimum results. And the optimum results are based on where you put the plate. And if you put it over the motor point, you're going to get the best results. And I was playing with the plate and saw that it caused muscle contraction to occur stronger in some areas than other patients. And I remember I was like, I think that book has that, and I went to my library, and sure enough, I found it there, and it's been invaluable. I guess I was naive to think that I was going to treat the affected side where the infection and the multiple surgeries were, and take care of the atrophy there, and not have to be concerned about the patient's left leg, because he wasn't walking any more on the left leg than he was on the right leg. And the left leg didn't know that it didn't have any disease, but it certainly had atrophy. And it suffered the same atrophy as on the right side. And just because the patient could walk using a walker and kind of like hopping, because remember, when they tried to put weight on the right leg, it collapsed because it couldn't come to full extension during the swing phase of the gait cycle. you have to consider treating both extremities. You don't have to treat both extremities in the arms because the patient can use the other arm. But failure to treat the contralateral side will result in prolonged treatment, because when the patient gets the sick side better, the well side has to catch up with what you've done on the bad side. So make sure you consider the non-diseased extremity if you're treating lower extremity. So these are the codes, and that's the end of my presentation. Gerald is going to talk to you now about how to bill, how to treat.
Yes.
I'm done. You can still ask questions.
Yes, thank you so much, Dr. Tomczak. That was a lot of information and a lot to talk about during Q&A. But as you mentioned, before we get to, let me take the screen back so that we can, just give me 1 second to show my screen. All right, so as Dr. Tomczak mentioned, we'll be right back to him for Q&A. We want to introduce Gerald Gable, who is the Vice President of the Physical Medicine Division at Zimmer MedizinSystems in the US. He would like to come on and say a few words about the emFieldPro HEIT system for just a couple minutes, and then we'll get to Q&A, we promise. Hi, Gerald.
Hi, Regina. Thank you very much.
Thank you.
And
I'm going to make you presenter here.
okay,
Oh.
Good.
Okay. All right, in just a moment, we should be able to see your screen.
Okay.
There we go, we see it. So I'll be back after your presentation.
All right, very good. First of all, thank you, Dr. Tomczak, for your excellent presentation, and congratulations to your outcomes that you achieved with the emField. That is really awesome, and it speaks the same language that we hear from so many practitioners and patients out there. Awesome. Again, here are the codes for reimbursement: electrical stimulation, then therapeutic exercise and therapeutic activities. These two would be used if you strap the emField arm to a leg, for example, and let the patient do leg extensions or quads, any of these kind of things. And then, of course, neuromuscular reeducation. But besides the reimbursement, I really want to talk a little bit more about the cash options that are available and are used intensively by practitioners out there. And I want to show an example here of a chiropractic clinic in Florida with one chiropractor in the clinic, 2 CAs, 1 receptionist, and 1 emFieldPro unit. And in this case, the chiropractor recommends the high energy inductive therapy during his consultation with the patient, and also explains that 1 session would be $98 with the high energy inductive therapy unit, and the patient will be charged these $98 for every session they need to do until their issue is resolved. And in this case, no packages, no treatment packages are sold to the patient. And in the clinic, they deal with around 10 patients per day on the emField. So what does that look like in terms of return on investment for this specific case? Obviously, you see the $39,900. That's the cost of the system that they wanted to buy outright without any financing, so they charged it to their credit card. The price, as I said, $98 per session and 50 sessions per week. That is 10 per day. And that accumulated to already $210,000 of revenue in the clinic after the first year. I should mention also in these 210 are included the $13,000 of Section 179 deduction, which is a really great tool that you should use if you want to get something like the emField into your clinic. Talk to us. We can explain how to do that. It is a government incentive program to incentivize you as doctors and clinicians to get capital equipment into your clinic and invest. Okay. Another example, a chiropractor in South Texas, one chiropractor, one doctor in the clinic, 2 CAs and 2 emFieldPro units in the clinic. He started out with 1 emFieldPro unit in his clinic, but after about 1 year, the machine was booked out all the time and the demand of patients was increasing more and more. So he decided to get a second unit. Here, it is different, but also in the consulting discussion, the doctor offers a 10-minute session, free trial for the emField if it's indicated for the problem that the patient has. This 10 minutes free trial for the patient, and then afterwards it will get evaluated with the CA, and then they can decide if they feel that it helps them and it helps the indication. They can sign up for a 5 times 20-minute program that would be $345, or 10 times 20 minutes program that would be $650. And 90% of the patients sign up for these programs because they feel the effect that the emField has. They feel the benefit that they are getting from this therapy. It's really an unprecedented therapy. And obviously also this is the cause why this doctor already had, after 1 year, the demand to get a second unit in his practice. So now, to get more of the high energy inductive therapy units into clinics and into practices, we have a special offer for you that is valid 2 months from now on. And that, of course, includes the emFieldPro therapy unit, the dynamic handpiece, the static handpiece, and the articulating arms, 3 sizes of straps that come with the machine to strap the handpiece to any body part where it is needed. And additionally, you will get full access to the Zimmer Academy training and certification course, and clinical marketing package is also included. That means you get materials for your clinic, like roll-up banners that explain a little bit about the therapy, waiting room brochures where your patients can already read on what is the therapy about, what does it do. All of that gets to you free for the first 3 months, and after that, it's going to be $833 for 60 months. And coming back one more time to the return on investment, because I hear this a lot, that people say, oh, do I really get my money back when I invest it? Yes, you will. Now there's an example that shows with very low numbers how you can get your money back in the first year. So let's say you buy the machine, $39,000. You only be able to take $69 per session, and you will only be able to do 10 sessions per week. That would be 2 a day. And still, and of course, you finance the machine and no Section 179 depreciation, which I would never recommend. But still, in this case, you would already end up with $23,000 after the first year. Now, take into consideration the Section 179 and add already, depending on your tax bracket, $10,000 to $13,000 to the 23. Now, what would happen if you say we can achieve $120 as a price in our clinic, which is totally realistic. I have people and doctors that charge $150 and even more, but around $100 and $120 is the average that we see. So $120 per session, and you will do 50 sessions a week, so 10 a day, like the first example did in Florida, and you will end up with almost $300,000, $291,000 revenue in the first year. I have to say here also the Section 179 was applied, so it's $13,000 of tax savings, but still almost $300,000. That's awesome. And that is awesome additionally to the benefits that you will get for your patients. Your patients will love you for this therapy because it's something that they have never experienced before. They will love it. They will tell every friend and every family member about this therapy. And you will soon see, once you have it in your clinic, you want probably a second unit as well. So that is it from my side. Thank you very much. And I'm looking forward to all the questions that might come. And I also believe after the whole Q&A, Regina will show information about contact information, how to contact me if you're interested to run through your numbers in your office, what it would look like in your office and financing, what the financing rates would look like, and so on. I'm very happy to help. Please contact me and we'll do that. Thank you.
Thank you, Gerald. Sorry, I popped up there, busted into your presentation for just a moment there. My apologies.
Not a problem.
But as promised, we'll get to the Q&A now. Stick with us, Gerald, and I'd like to bring Dr. Tomczak back in now for the Q&A portion. Hi again, Dr. Tomczak.
Hi.
Okay, so let's get to some questions here. The first one is, when you first got the device, how did you become more comfortable with trying it for different indications? Dr. Tomczak?
I had an in-service with Dan Uris, another in-service with Dr. Whiting, and Gerald was present, and they just reassured me that I wasn't going to hurt anybody. Try it on myself. It seemed to work okay, and I mean, I felt good with it, and the patient, like everybody said, the results are quick. I mean, you don't have to wait a long time. I mean, I'm not like the next day the patients feel considerably better.
Interesting. Okay. How much can I charge per emField treatment, and how is that received by the patients?
That is one of the questions, that I just had in one of my slides. I have, as I said, seen so many clinics and so many different approaches, but it's somewhere in the range of 60, 65 up to 150, and then I have some outliers that charge 200 and more, but then they also do an hour or longer. The typical session is 20 minutes by default in the program, in the protocol. So somewhere in the range of 65, which is on the low end, to 150, you're on the good side. And patients will appreciate that because their physical therapy copay is anyways already almost that high. And once they try it, and if you do that, like the example in Texas, 10 minutes for free, they will immediately feel, okay, this is something different. This does something that I've never had before. I will do that. I will pay for that.
Right. And Dr. Tomczak, you also touched on this, that patients notice a difference immediately. But how quickly do patients typically notice results, like real improvement after emFieldPro treatments?
I think our guy, within 2 weeks, he had an increased range of motion that was noticeable. And the muscle hypertrophy began, I didn't think it would be this quick, so I didn't bother to measure to get objective results. But there was an increase in strength that the patient noticed. There was an increase in size that I noticed. and there was a decrease in pain, which the patient noticed, and all within a couple weeks. I mean, the patient was really excited about this. So was I.
Yeah. Yeah, it sounds like it. Okay, so next question, so you're the patient. How does it feel for the patient during the therapy session? Is the therapy painful or uncomfortable for patients? And what does the patient feel?
When I tried it, I did a bunch of adjustments, and you can turn it up so that it's uncomfortable. It's not painful. It's just uncomfortable. You don't like it, and you think, oh, I'm not going to sit for this for 20 minutes. So you just turn it down, and then there's this threshold where it's not uncomfortable. It's actually kind of soothing, and the patient tolerates that very well. Nobody complains. They like it.
Did you mention what it feels like for the patient, what the sensation is?
I thought it felt similar to a TENS unit.
Okay.
But more intense, but not painfully intense.
Yeah. One of the points that I always get from doctors and practitioners, to say it feels like a shockwave and a TENS combined, deep and intense.
And neither of those really are painful separately. Yeah. Okay. So what are the main benefits of using HEIT for patients compared to other therapies like shockwave, laser, E-stim?
I don't want to disparage anything else, but since I've run into HEIT in the M field, I don't think that there's indications for the other modalities that would be near as beneficial as the M field. I mean, when your family notices the change, that's pretty impressive.
Yeah, that's saying a lot.
Yeah, when the patient's family notices and they haven't been treated.
Wow, that's significant. Can you review in simple terms how emFieldPro works to help promote healing in the body?
It opens the cell membrane,
okay,
so that intracellularly, when it's injured, there are toxins, dioxides, and edema. The cell membrane is opened up so that these I shouldn't use malignant, people get the wrong idea. When these toxins are present, they can be expelled and replaced by normal, good elements and endorphins and growth factors necessary to heal.
Okay. Gerald, this one might be for you. Do you know of any professional sports teams using this modality? It sounds like there might be a practitioner out there with connections thinking maybe this is something that a professional sports team might need.
Absolutely. And this is something that sports teams will love, because it will help the athlete to recover faster from injuries, but also from training sessions. And we in fact have NFL teams that are using it. We have NBA players that are using it. We have
drop a few names. You can't drop names, can you?
I should not. No, I should not. We have NDAs that we cannot drop names, but we have almost a handful of NFL teams that use it. NBA players, NBA teams, bodybuilders, professional bodybuilders, MMA fighters. So it's through all the professional athletes are using it. But we should not only think about professional athletes, think about the weekend warriors that have injuries, that come to your clinic and want to get back on track faster than the normal, how many therapy sessions to get to see a result. This will do the trick, and they will be so grateful for that. if you have that in your clinic.
Let me add, I have some friends at Johns Hopkins. They have 6.
Yeah.
They
That's a name we can drop.
well, we've done it. Okay.
It's actually 2 guys.
What role does the frequency setting play in the effectiveness of the emFieldPro treatments?
Again, this is whatever the patient can tolerate.
Okay.
And you know, I think when you introduce the patient to this modality, I think in the very first treatment, they're naturally reluctant. You know, I mean, how many times have they heard, "Oh, this shot won't hurt"? Hell, it won't. So you put this on the patient, and they begin to think that, oh, it's going to hurt. Oh, you know, when you think it's going to hurt, it does. But then they realize, no, this really doesn't. And then you can increase the frequency, and you can increase the power, depending upon which pre-selected
program
modality, or not modality, but which pre-selected treatment plan that you use.
You can, are there also, Gerald, you can also do custom programs as well, right? And save favorites. Does it have that capacity?
Yes, that is correct. Yeah. It comes with 6-26 preset protocols in the machine. And then you can add another 20 that you can totally customize to your own liking. Yeah.
If you find a protocol that works for you and your patients. Okay, great. Yeah, Gerald, you did go into a little bit of detail on this in your presentation, but maybe you have something more to add here. How can clinics market emFieldPro treatments to attract more patients seeking pain relief? And are there ready-made flyers, marketing materials for offices offering the treatments? You already mentioned that there are marketing materials that come with the purchase. So how else can they, how can offices market the treatments and make people aware?
As you mentioned, and as I mentioned before, we help everybody that comes to us and gets a machine from us, because we want that you have success in your clinic with the device. We want you to be a happy customer. So you'll have waiting room material that will help with the patients that they can already read on while they're waiting. We have videos and stuff for the waiting room TV, for example. Roll-up banners, but one of the major points of our marketing package, I should mention, is the social media marketing that we do for clinics. And this is also how, for example, Rod got in contact with Dr. Ben Uros, because he did use that social media marketing, and we put out a PR piece about his clinic, what he does, that goes out to all our email lists, to patients, all our social media channels, and we will obviously tag the clinician and their webpage to send traffic their way and interesting customers and patients their way. So this is really a big thing, and obviously you are very much involved in that, Regina. That's an excellent job that you do there with all these PR pieces, and the customers like it so much, and they're very happy to have that.
That's great to hear. Okay,
word of mouth. When you get a patient that this really works for, they're going to tell everybody.
Yeah.
And that, to me, that's the best publicity that you can have.
Yeah.
Yeah, that's another big one, word of mouth, because as I said, the patients will love that, and they will tell everybody.
All right, I just looked at the time. We're running a little bit over, but this is good stuff. So let's do a couple more questions, probably one more for Dr. Tomczak, one more for Gerald. Dr. Tomczak, how are the right settings like frequency and intensity typically decided for a treatment case? As you mentioned, just kind of what the patient can tolerate.
The way that the emField is set up is that you pick the treatment plan that would be most beneficial for the patient. Then you apply the applicator, and there's only one dial. It's really simple. One dial, you turn it up, and when the patient begins to experience it, they can say, yes, I feel it. Is it uncomfortable? No, but I feel it. Turn it up. When it begins to feel uncomfortable, that's when you back it down. And that changes every time that the patient is subjected to the treatment, because as they get better, they don't need as much,
Right.
as much power, and it's frequent.
Excellent. Gerald, is the product FDA cleared? Talk to us about that.
Yes. All the products that we sell are FDA cleared. We never sell a not FDA cleared product here at Zimmer MedizinSystems in the US, which is very important, not only for us as a company to be on the right side of the law, but also for you as clinicians to have the safety to be on the right side and not running into problems later on if you use something that is not FDA cleared. And there are a lot of devices out there where people try to cut corners, and unfortunately most of the time it fires back at one point. So do yourself a favor, go for a product that is FDA cleared and not run into trouble later on.
All right, great. Well, I'd love to keep on asking questions. We've just kind of run out of time, but we will email answers to all of the questions that have come through that we weren't able to get to. Gentlemen, thank you so much for your participation in the Q&A and both of your presentations. Good night to both of you, and again, very grateful for your insight.
Thank you so much.
Thank you, Regina. Thank you, Dr. Tomczak. Thank you. Have a good evening.
Have a good weekend, folks.
All right, for the attendees, I have one more slide. Let me share that. If anyone would like more information about the emFieldPro, please visit Zimmer MedizinSystems website at www.zimmerusa.com. There, you can access more information about the device. Zimmer MedizinSystems also has an assortment of waiting room materials available for you to browse on the shopping site at shop.zimmerusa.com. If you'd like to speak with Dr. Tomczak directly, please send an email to info@zimmerusa.com. Zimmer MedizinSystems can forward your inquiries and connect you to him. This concludes the webinar. Thank you very much for attending. A recorded version of this webinar will be emailed to all attendees so that you may review any of this information at your leisure. Good night.